So first, I want to turn to Senator Dr. Bill Frist. Senator, we met when you had just become the Senate Majority Leader in the Bush administration in about 2003, maybe a little bit before then, and you were shaping and pushing through what became PEPFAR. Will you share with us what PEPFAR has meant to you since its inception, now saving the lives of more than 26 million people, and in conjunction with other global health programs? Why is it important to see this through to the end in the fight to end AIDS?
Jenny, great. Thank you. And it's a real pleasure to be with everybody today. A little bit of history. When I think about PEPFAR, I really don't begin with the legislation itself. I begin with FACES. In the early 1990s or late 1990s and early 2000s, more than 3 million people were dying each year from HIV/AIDS. Literally, entire communities in sub-Saharan Africa were being hollowed out, and hospitals were filled, yes, with the elderly, but more remarkably, in many ways, with young mothers and fathers, literally in the prime of their life. And children were just raising children. As a physician, I treated AIDS patients in the United States, but when I traveled to Africa, what I saw was totally different. It was different in scale, it was different in suffering, in urgency. I would walk into these rural clinics where medicines, if they at all, were scarce, and hope was even more rare. Yet trust in American doctors and nurses was deep. At the time, I would see warring fractions or factions pause their fighting so that treatment could be delivered, and even for a few sacred hours, healing would replace violence. And all those moments stuck with me and stayed with me. At the time in the Senate, I was the only physician and the only senator clearly who had repeatedly delivered medical care in sub-Saharan Africa. So I knew the science, and we had just developed these effective antiretroviral therapies. We understood how to prevent transmission, but what we lacked was not knowledge. It was, and again, this was 25 years ago, was the political will, and we lacked the scale. And so what was really neat about the time is that we began building it. In the Senate, I had the opportunity to work across the aisle, starting with budget amendments to increase funding for the global AIDS fight. And this was early on. Senator John Kerry, a Democrat, I was a Republican, we partnered to pass a budget resolution that doubled funding for HIV/AIDS programs at the time. And then it was still controversial in many ways. HIV still carried a stigma. Some questioned whether America should stand up and lead it all. And then came the pivotal moment that we've mentioned. President George W. Bush, guided by his own deep personal faith and a belief that we are called to care for the hurting and the widows and the orphans and the underserved, asked Dr. Tony Fauci a simple question: could the United States truly make a difference? He sent, or Dr. Fauci traveled to Africa, saw the crisis firsthand, looked back at the resources of the United States, what we could do if we did come together, and returned convinced that we could. Mark will be speaking here shortly, but there were a few of us, really a pretty small group, who knew the president would announce this bold initiative in his 2003 State of the Union address. I remember it vividly. It was towards the end, but when he did, he committed $15 billion over a 5-year period to combat HIV/AIDS, tuberculosis, and malaria. And at that time, an unprecedented pledge. Then, as majority leader, once announced, my responsibility was to get it passed and to get it passed as soon as possible. And then the story is really pretty cool overall. It was pretty extraordinary. It was not simply legislation, but it really became a moral coalition. Jenny mentioned Bono, or Bono was mentioned at that time, well known globally, of course, with you two. And we met around 1998, 99, doing some debt relief. But then we toured Uganda together. We visited clinics, listened to families. Jenny will remember it on World AIDS Day in 2002. He launched the Heart of America tour and calling on Americans, not just people on the coast and people you might expect to be on board, but calling Americans across the country to lead in reversing the epidemic. Franklin Graham, a great friend and a friend to many of you, mobilized faith communities, and he had a sort of a really important role in helping Senator Jesse Helms see this moral imperative of responding to HIV/AIDS, and they prayed together. And Senator Helms, interestingly, who had long opposed international AIDS funding, and he was an icon, a conservative icon at the time. Everybody listened to him, but he had opposed international AIDS funding. But then he experienced a genuine change of heart. And he wrote a fantastic article in the Washington Post specifically saying this turn of events in his mind that we cannot turn away when we see our fellow humankind in need. And that moral clarity unlocked this bipartisan support. And on May 16th, 2003, in record time in many ways, the Senate passed what became known as PEPFAR, the President's Emergency Plan for AIDS Relief. The House had passed it 375 to 41. Bipartisan people had come together. But in many ways, it did take the community, the faith community, to make this big pivot. And it does remain the largest commitment any president has ever made to combat a single virus, a single disease. Obviously, COVID has changed that to some extent, but this single commitment up front. The results are historic. AIDS-related deaths globally have fallen by 74%. The 26 million lives saved is real. These are real lives, 26 million mothers and fathers and sons and daughters and teachers and farmers, all alive today because treatment reached them. But the big thing is that PEPFAR did so much more than save lives. It strengthened the infrastructure of health systems. It improved maternal care and child health and laboratory capacity and data infrastructure. It improved these systems. Worker productivity increased. Economic stability increased. It enhanced our moral leadership abroad, and health and healing became a bridge to partnership. And as I saw on my repeated trips, a means to peace. So when I go back to Africa now and I meet young adults who are alive and families alive because of this health infrastructure funded through PEPFAR, because of the antiretroviral viral therapy, because of prevention, I'm reminded that this was really just never abstract policy, but profoundly human. The story's not finished. HIV/AIDS remains an epidemic in parts of the world, as we all know. The science has gotten even stronger. Treatment not only saves lives, it prevents transmission. We have prevention tools that have become more sophisticated, and data systems are smarter. So the question is no longer, can we end the epidemic status? It really is, will we sustain the political will to finish the job that we started now 25 years ago? 3 million deaths per year once felt impossible. It felt insurmountable to address. Today, ending the epidemic status by 2030 is within reach. But progress can stall, and as we know, attention can drift, and funding can erode, and viruses in the meantime just don't wait. And if we learned anything in these early days of HIV, it is that silence and hesitation cost lives. If we learned anything from PEPFAR itself, it is that courageous leadership saves them. And for me, PEPFAR does represent America at its best. The science, the compassion, the coming together across party lines. And because we did choose to act now, 25 years ago, 26 million people are alive today. And now we carry this responsibility we're talking about today to ensure that this next generation grows up in a world where AIDS is history and not destiny. And we've just come way, way too far to turn back at all now. So now, and that's the subject of what we're talking about today, let's finish what we started. Thank you.